Hello friends, welcome to Nursing Guide. Today we are going to discuss about RRB exam MCQ. First question is, which among the following food item need to be avoided by an immunocompromised person who is experiencing frequent diarrhea? Option A, rice water. Option B, milk. Option C, fruit. Option D, curd. The correct answer is option B, milk. Milk is the food item need to be avoided by an immunocompromised person who is experiencing frequent diarrhea. Next, another name for collapsing pulse is option A, thread pulse. Option B, water hammer pulse. Option C, bounding pulse. Option D, pulse deficit. The correct answer is option B, water hammer pulse. Water hammer pulse, also called as collapsing pulse. Next, while taking the temperature of an HIV positive client, the nurse should option A, wear all PPE. Option B, wear mask and gloves. Option C, use 1% hypochlorite solution. Option D, wash hands before and after the procedure. The correct answer is option D, wash hands before and after the procedure. Next, a lethargic patient has fever, vomiting and headache. The nurse has to prepare him for which of the following procedure? Option A, blood culture. Option B, lumbar puncture. Option C, CT scan. Option D, ultrasound. The correct answer is option B, lumbar puncture. A lethargic patient has fever, vomiting, headache. The nurse has to prepare him for lumbar puncture. Next, which of the main function of the hypoglossal nerve? Option A, vision and sensation. Option B, sensation and hearing. Option C, hearing and smell. And option D, swallowing and speech. And the correct answer is option D, swallowing and speech. Main function of the hypoglossal nerve is swallowing and speech. Next, when a person swallows food, which part of the digestive system allow food to pass from the mouth to the esophagus by closing the tracheal opening? Option A, pharyngeal rings. B, epiglottis. C, cricoid process. And D, glottis. The correct answer is option B, epiglottis. Next, which of the following is a female pelvis? Option A, anthropoid. Option B, platypaloid. Option C, gynecoid. Option D, android. And the correct answer is option C, gynecoid. Gynecoid pelvis is the female pelvis. Gynecoid pelvis, also known as female pelvis. Next, the removal of the tissue from the pleural space is known as option A, liver biopsy. Option B, lung biopsy. Option C, spleen biopsy. Option D, breast biopsy. The correct answer is option B, lung biopsy. The removal of the tissue from the pleural space is known as lung biopsy. Next, nursing measures for a patient who is complaining of difficulty with micturition include option A, sound of running water. Option B, stroking the inner thigh. Option C, pure lukewarm water over the perineum. Option D, all of the above. The correct answer is option D, all of the above is measurements for the patient is complaining of difficulty with the micturition. Next, the pacemaker of the heart is option A, arch of the aorta, option B, bundle of His, option C, AV node, option D, SA node. The correct answer is option D, SA node. SA node is the pacemaker of the heart. Next, nearsightedness is also known as option A, myopia, option B, presbyopia, option C, hypermetropia, option D, cataract. The correct answer is option A, myopia. Myopia is also known as nearsightedness. Next, the most unreliable method of sterilization is option A, chemical sterilization, option B, filtration, option C, sunlight, and option D, autoclaving. And the correct answer is option C, sunlight. Sunlight is the most unreliable method of sterilization. Next, which part of the digestive system allow the esophagus to connect with the stomach? Option A, diaphragmatic hiatus, option B, esophageal hiatus, option C, cardiac sphincter, option D, pyloric sphincter. The correct answer is option B, esophageal hiatus. Next, about Kawasaki disease, all are true except option A, seen in children, option B, coronary artery is involved, option C, mucocutaneous lesions, option D, suppurative lymphadenopathy. The correct answer is option D, suppurative lymphadenopathy. Next, redness over the bony prominence of a bedridden patient suggests option A, ulceration, option B, poor nutritional status, option C, bed sore, option D, wound infection. The correct answer is option C, bed sore. Redness over the bony prominence of a bedridden patient suggests bed sore. Next, strawberry tongue is seen in option A, PAN, polyarteritis nodosa, option B, MPA, microscopic polygenitus, option C, Kawasaki disease, option D, Wegener's. The correct answer is option C, Kawasaki disease. Strawberry tongue is seen in Kawasaki disease.